So we had a problem trying to analyze our call recordings on a routine basis. And so we engaged Zenphi to be able to connect into our call database, to be able to kind of download our phone calls, transcribe the phone calls, and then analyze the calls, and be able to create a format that's easily searchable and readily available for us to use. So that was our main use case for our first Zenphi automation workflow.
Amazing. So I know many healthcare organizations start thinking about AI for customer support first. Your team started with operational workflows, and what made you focus on operations first?
Yeah, I think we want to see AI in healthcare be a support to the people, not a replacement of the people. And I think that we're trying to build tools that really support our operations team to be able to do what they do, but do it in a better way or a more efficient and effective way. And so part of our focus is how we could add tools onto our teams that are going to enhance their current workflows or improve their communication between teams. And we see the first automation that we've done here to be able to enhance our ability to not only understand what our people are going through and what they're dealing with, but then have better responses and better built tools to support those people that are doing the frontline work in healthcare.
Okay, perfect. At what point did you realize that phone calls were a source of operational data that was just sort of not being tracked and utilized properly in your organization?
Yeah, as our team has grown and as our organization's grown, we've seen our call volume grow, and the amount of time we spend on the phones, talking to patients, talking to employees, solving problems has grown. We started to track this a few years ago during COVID, and we started to monitor not just the number of calls we take per day, but also the length. And then we started to look into the severity of the call and what actually happened. And we noticed that a lot of our teams spent time where we want them to, talking and engaging with our frontline healthcare workers and our patients and families. But then there's another component of that, which would be documenting those calls and addressing the needs that are brought up during those calls. And we see a lot of time spent talking to people and then documenting what's going on. And as we've grown as an organization, we found that we need to solve kind of a time management problem there. And so we decided to engage Zenphi to help bolt on or help us to transmit calls in a fashion that would allow us to transcribe the call and then analyze the call and then be able to use that analysis to help us with better note taking, help us with better follow-up and follow through with patients and employees, help us identify risk factors or dangers. And so really that's an add-on that we've seen to help save some time in our documentation process, and then enabling our care managers and our frontline workers to spend more time with people and patients and less time with documentation and making sure they get their notes perfectly in order.
Okay, perfect. How did that change the daily workload for your ops team? So like how many hours would you estimate you've saved so far?
Yeah, so I think, our traditional model was about 3 to 4 hours a day per care manager of documentation, note taking, entering information into the system. We've probably cut that timing in half by being able to introduce this. It's not a perfect solution, but it certainly is better than what we've had. And I think we see the ability to reiterate on top of what we've currently built. And we believe that reiteration will only serve to better engage and better support our care managers and our organizational processes. So we've saved some time for sure. And then we've been able to, again, integrate some new procedures that I think will, in the long run, help our team better engage and adapt to different scenarios that come up when we're providing patient care in the home.
And from a compliance perspective, what's the impact been, or what do you foresee the impact is?
Yeah, we've seen a better ability to understand and kind of analyze the kind of calls that come into our organization and then be able to respond to those needs a little bit quicker, faster. One thing we're working on currently is kind of not predictive analytics, but using uh, AI to help understand calls and the nature of a call and be able to pick out maybe certain keywords that might indicate a potential problem. And we want to be able to address problems before they become larger concerns. And so right now we're working on how can we pick out certain variables that might be concerning or alarming for us. But in the future, I could see us using a better model where maybe we use a little more predictive analytics to analyze how many times or how frequently is a patient or an employee calling in, and what are the natures of those calls, and are we having potential problems or potential issues, that were not being addressed, or are there underlying concerns that we could address by analyzing the data in those calls. So I think from a organizational standpoint, we see our ability to become a little bit more efficient and effective, and try to use AI, and Zenphi has been able to kind of help us plug into those tools as a support mechanism to our people and within our organization.
And now that that's been automated, what additional processes are you looking to improve with AI?
Yeah, I mean, we see the ability to use AI to analyze not just phone calls, but visit data information, patient data information. So, for example, we care for a very sensitive population, and we can monitor and track, how well patients are doing or how well employees are doing. And we see the ability to kind of streamline some of our workflow processes or potentially automate some of the workflow processes to evaluate how well our employees are performing over time. How often are they late to work, or how often are they getting the right things done and then rewarding that, or looking at evaluating hours worked per day, per week, per month, and are we trending towards burnout? Are we trending towards a healthy work-life balance? So I think in the future we could see utilizing more and more tools to kind of analyze our current operations and then help us to make supportive recommendations or maneuvers to support the people doing the work we do.
And if a home care agency or a small healthcare clinic wanted to start using AI today, what process would you recommend they start automating first, or how would you recommend they go about that?
Yeah, I think the first thing you want to always do is evaluate what are your current processes and where do you spend the most amount of your time. There are tools that I think AI can help enhance or solve that are not as they might be efficient, but they may not be as effective as we think. And so I think it's really important to spend time kind of breaking down where your processes are set at, what you think you need the most help with, and then how you think AI can build a tool or help you build a tool to solve that problem. And just be prepared to know that even though you have the goal, of X, you might end up with Y, and that's okay. In the process, you're learning, you're going to be reiterating on that. And the best thing you could do is just start doing your research, start doing your homework, and talk to the people at Zenphi who have done this for many, many businesses, who look at what are you currently doing? How can we build and help you support building a tool that will improve one of your processes or enhance one of your processes, or change one of your processes altogether for the better. And I think there's a lot that you can learn from just trying it out and then kind of seeing where that can go. I think that the modeling for the future of healthcare particularly will be AI supporting healthcare practitioners. And that support can come in a lot of different ways. It's just all about how you want to build and design that for your own organization.